If you wake up every single morning with a mouth that feels dry, sticky, rough, or almost glued shut, this may be one of the most ignored warning signs people over 50 keep brushing aside. And the scary part? Sometimes the problem is not your mouth at all. It is what is happening to your body while you sleep. Most people think morning dry mouth is harmless. They wake up, drink water, maybe clear their throat a few times, and move on with the day. But when your body repeats the same symptom every morning, that is not random. Your body is trying to get your attention. And tonight, before you go to bed, I want you to pay very close attention to what happens when you wake up tomorrow morning. Because what feels like a small annoyance could actually be connected to your breathing, your blood sugar, your medications, or even your heart health. And trust me, one of the causes I'm going to mention later surprises almost everyone. If videos like this help you understand your body better, take 1 second to like the video and subscribe. It helps more adults over 50 find this information before small symptoms turn into bigger problems. Now here's what most people do not realize. Saliva is not just spit. Your saliva is protection. While you sleep, it protects your gums, your teeth, your tongue, your throat, and even helps control harmful bacteria inside the mouth. It keeps tissues smooth. It helps digestion begin. It helps you swallow comfortably. It even affects the way food tastes. So when your mouth stays dry for 6, 7, sometimes 8 hours straight overnight, your mouth loses one of its main defense systems. That is why people with chronic dry mouth often wake up with bad breath, cracked lips, sore throats, a burning tongue, thick saliva, or that strange coated feeling that never fully goes away. But here's where things get more serious. Sometimes dry mouth is not the real problem. Sometimes it is the clue that something bigger has been happening all night long without you realizing it. The first thing I want you to think about is this. Are you breathing through your nose while you sleep or through your mouth? Because mouth breathing is one of the biggest causes of waking up dry every morning. And many people do not even know they are doing it. They only know they wake up thirsty, tired, foggy, and uncomfortable every single day. Imagine air moving across your tongue and throat for hours non-stop while you sleep. Everything dries out. Saliva thickens. Your mouth loses moisture all night long. And what happened next shocked many patients I've worked with. The dry mouth was not actually the main issue. It was sleep apnea. This is where breathing repeatedly slows down or partially stops during sleep. The body struggles for air. The mouth opens. Sleep quality crashes. Oxygen levels can drop. And many people ignore the early signs for years. If you snore loudly, if you wake up exhausted even after 8 hours, if you wake up with headaches, if someone says you gasp, choke, or stop breathing at night, please do not ignore that dry mouth anymore, because your mouth may be exposing what your sleep has been hiding. And here's the dangerous part. People often treat the symptom while completely missing the cause. They buy sprays. They keep water beside the bed. They switch toothpaste. They suck on lozenges. But the real issue was poor breathing all along. And poor sleep affects everything. Blood pressure, memory, focus, mood, energy, even heart strain over time. That tiny dry feeling in the morning may actually be connected to what your body survived during the night. Now let me tell you about another cause that quietly affects millions of adults every day: medications. And honestly, this one gets missed constantly. If you take blood pressure pills, allergy medications, antidepressants, sleep aids, anxiety medications, bladder medications, or even nighttime cold medicines, your dry mouth may not be accidental at all. Many of these medications reduce saliva production. But here's the part most people never hear. One medication may cause mild dryness. 3 or 4 together can leave your mouth feeling like sandpaper every morning, especially after 50 or 60. And people often blame dehydration when the real issue is medication burden. Now please hear this carefully. Never stop a prescribed medication on your own. But if your dry mouth started after a new prescription, after a dose increase, or after adding another pill to your routine, that is a major clue your body is giving you. And most people miss it. This is why medication reviews matter so much. Sometimes one small adjustment changes everything. Now here's another warning sign many people overlook until much later: high blood sugar. And this is where things can become dangerous quietly. If you wake up with dry mouth and you are thirstier than normal, using the bathroom more often at night, feeling exhausted during the day, noticing blurry vision, or healing slower than before, I want you to take that seriously. Because high blood sugar pulls water out of the body, and sometimes dry mouth becomes one of the earliest warning signs before diabetes is even diagnosed. But most people dismiss it. They say, I'm probably just dehydrated, or I guess this is normal aging. Meanwhile, the body keeps sending signals every single day. And the scary part is this: many people only discover the problem after months or years of symptoms they ignored. That is why repeated symptoms matter. Your body whispers before it screams. Now, yes, dehydration absolutely plays a role too, but most people think hydration is just about drinking one giant glass of water before bed. That is not real hydration. Real hydration is what happens all day long. And as people get older, thirst signals often become weaker. Some people avoid water because they do not want to wake up at night. Some drink too much coffee. Some drink alcohol late in the evening. Some take water pills. Some eat salty, processed foods constantly. All of that pushes the body closer to dryness. But here's the important part. Water alone does not fix every dry mouth, and that is where many people get stuck. If your real issue is sleep apnea, blocked nasal passages, medications, or blood sugar problems, you can drink water all day and still wake up dry tomorrow morning, because the root cause is still there. And now I need to mention something most people have never even heard of: an autoimmune condition called Sjogren's syndrome. This condition attacks the glands that produce saliva and tears. So if your dry mouth comes with dry, burning eyes, unusual fatigue, joint pain, or that constant inflamed, exhausted feeling, please do not ignore that combination, because many people spend years treating the symptoms separately without realizing they are connected. Eye drops for the eyes, mints for the mouth, water for the dryness. But the actual issue was deeper the entire time. And this is exactly why listening to repeated patterns matters so much. The body repeats symptoms for a reason. Now here's something else people rarely talk about. Dry mouth does not just affect comfort. Over time, it can affect confidence, eating, nutrition, even social life. Some people stop eating certain foods because swallowing becomes difficult. Some stop enjoying meals because food no longer tastes the same. Some avoid conversations in the morning because their mouth feels sticky and uncomfortable. And slowly, quality of life changes. That is why this is not just a dry mouth. And before I tell you what you should do next, there are a few warning signs I never want ignored. If your dry mouth comes with white patches inside the mouth, bleeding gums, mouth pain, trouble swallowing, rapid tooth damage, chest symptoms, confusion, or sudden weakness, do not wait around hoping it disappears. Get checked, because sometimes dry mouth is riding alongside a much bigger health problem. Now here's what I want you to do starting tonight. First, stop calling it nothing. If it happens once in a while, okay. But if it happens most mornings, your body is trying to tell you something. Second, pay attention to patterns for the next week. Do you snore? Do you wake up tired? Do you wake up with headaches? Do your eyes feel dry too? Did symptoms begin after a medication change? Are you waking up several times to urinate? Those details matter more than people realize. Third, write down every medication and supplement you take. Everything. And ask your doctor or pharmacist a very simple question. Could these medications be causing my dry mouth? That one question alone has helped many people finally understand what was happening to them. And if you suspect your breathing is poor during sleep, ask about a sleep study. Please do not ignore that, because sometimes the symptom you notice first is not the biggest problem your body is dealing with. And finally, protect your mouth while you figure out the cause. Use a humidifier if the air is dry. Avoid alcohol-based mouthwashes. Support nasal breathing. Use sugar-free xylitol products if recommended. Stay hydrated consistently throughout the day instead of overloading water at night. And protect your teeth and gums, because low saliva increases dental problems much faster than many people realize. Now I want to leave you with this thought. Your body is usually more honest than your habits. Your habits say, it's probably nothing. Your body keeps repeating the same signal every morning, again and again and again, until eventually you either listen or the problem becomes impossible to ignore. So tomorrow morning, if you wake up dry again, do not just grab water and forget about it. Pause for a second. Ask yourself, why is this happening? Is it my breathing, my medications, my blood sugar, my hydration, my sleep? Because once you ask the right questions, symptoms stop being random annoyances and start becoming valuable warnings. And if this has been happening to you, I want you to tell me in the comments, what do you think is causing your dry mouth? I read those comments carefully, and your experience may help someone else realize they are not alone. And if you know someone over 50 who keeps waking up dry every morning but keeps saying, it's nothing, please share this video with them, because some of the biggest health warnings do not arrive with sharp pain. Sometimes they arrive quietly, softly, repeatedly, every single morning.